And welcome back. Approximately 6.5 million people ages 40 and older in the United States have peripheral arterial disease. It's also known as PAD. PAD is a circulatory system condition caused by the gradual buildup of cholesterol plaque in the arteries. PAD can happen in any blood vessel, but it's more common in the legs than in the arms. Recently, we spoke with the Chief Medical Officer at American Endovascular and Amputation Prevention, Dr. Elsie Koh, and we spoke with her about this matter. Let's go to that right now.
Oh, you're welcome. Thanks for having me.
Thank you. When we talk about 6.5 million people, that is a large population of people. And when we talk about PAD, it's something that so many people may not be so familiar with. How common, how prevalent is this in our community?
Oh, well, it's very prevalent when you really hone in on who has the risk factors. So the people who have diabetes, hypertension, high cholesterol, are smokers, kidney disease, people with history of stroke or heart attack, they're at very high risk of having PAD, older age, 50 and older, really. And it's really important for you to get some screening from your doctor if you have some kind of leg pain. If you're walking down the street and you have to stop because you develop pain in your legs and you can't go any further and you have to rest them before you go on, that's one of the first things that we think about.
And when we talk about this here, let's talk about some symptoms, because for many people, they may not be so familiar, but what are the symptoms of PAD?
So there's a range of symptoms from when it's mild to when it can be very severe. So like I said, the earliest sign is what we call claudication, which is pain on walking or doing any kind of exertion in your legs. But if you have more advanced disease and say you have diabetes and now you have what's called neuropathy or numbness of your feet and ankles and you can't feel your feet, you might develop a sore on the bottom of your foot that you didn't even know was there. And that because you're walking on it, it just starts opening up bigger and bigger. That's kind of where you see the end stage. Your nails might not be growing normally. The hair growth might be, abnormal. You used to have hair and now you don't have hair there in your foot and your lower leg anymore. Those are signs that you're not getting good oxygen to your feet. And basically it's just a lack of oxygen to your feet. And particularly affects the toes and the feet the most because it takes that much longer to get down there. And then you might be going to sleep and you can't, you wake up in the middle of the night because your feet and your feet are numb and you can't feel your feet and you have pain. And a lot of times patient might say to us, well, I notice that I have to get up and dangle my feet at the side of the bed because you want gravity to kind of get the blood to go down. So they might say, I sleep with my legs dangling off the side of the bed, which is abnormal, or I might need to get up and stand up so that I can feel my feet again. That's an abnormal sign too.
Yeah. So the question becomes, what is the trigger point of saying, listen, I really need to come in. I really need to get checked out by a physician?
Well, when you're not able to perform normal activities, that's a big sign that you need to have something done. Certainly, you should be having your physical every year with your physician and telling them and being very mindful and writing notes down before you go see your doctor of things that you want to ask about. Because sometimes you go there and you forget, oh, I should have asked them about my legs. So if you're very mindful, write things down before you go. If you notice that you're not able to do the things that you normally used to do, it's not part of normal aging. You have to be very clear to your physician because sometimes they try to pry it out of you, but sometimes it's just so much easier for the physician if you told them exactly what's going on and what's been bothering you. You're not able to walk down the street like you used to, and you have to stop. Your friends have to wait for you until you catch yourself going. It's kind of like, right before you have a heart attack, you might have chest pain and you feel like something is going on and it might be your heart and you don't know. It's the same thing with the legs. The same disease that affects us when we get a heart attack or a stroke is the same disease. It's called atherosclerosis of the legs. And it's what we call, it's almost like angina, or if anyone heard of angina, you might call it angina or angina, which is the pain in the chest that's related to not getting enough oxygen in your heart. Same thing happens to your legs.
Yeah. We know that one of the things that happens sometimes as a result of this is amputation. And for the American Endovascular and Amputation Prevention Group, you guys are also considered limb salvage experts. So, can you give us a little bit about why you're considered an expert in this field?
So Darren, that's a really, really good question. You know, sadly, not everybody, not every doctor is the same. And I think everybody knows that. Like, I like this doctor, I don't like that. Not everyone has the same skill set. What we've discovered, just even, you know, very recently, cutting edge is kind of what we do. We are super specialists. We're not just interventional radiologists and vascular surgeons, but we really hone in on this kind of disease. And what that means is that we are skilled to do things that the community hospitals and even academic centers may not be able to do. We see their failures. What we do that's different is that we have tools that are so tiny, the tiniest, the skinniest wires, as thin as your hair, that we can wiggle down all the way down from, you know, where we access the artery. We go into the artery. We're basically plumbers of the human body, and we basically thread a little wire along with a tiny straw, like a catheter, down your artery to open up the blood vessels down to the toe level. And a lot of doctors, if you ask them, do you treat blood vessels below the knee? You know, do you treat the arteries below the knee? And if they say no, then you know that they might not be the right person for you. So we actually go down. I mean, I just came out of the OR today and we were treating blood vessel in somebody who has a big ulcer in their heel and it hasn't been healing. And he's got the tiniest arteries around the foot. And we got the wire to go all the way down almost to the forefoot and around a loop. And we use a 1.5 millimeter balloon, which you can imagine, I mean, it's so tiny, but we can see it. And that's what makes the difference.
Yeah. And so we hear a lot of times people are in need of an amputation. But for someone who's out there, that could be, you know, it's emotionally, psychologically, it's a traumatic thing.
Yeah.
But talk to us about when somebody is diagnosed with an amputation. Is that final?
I mean, I'm so glad you're asking all the right questions. So if you're being told that you need an amputation, I would give us a call, or you have a family member or a friend, because we have been able to save patients from amputation about 80% of the time, which is pretty high. And the rate in the United States is a little bit sad. And you would think that we all have the same kind of level of care across the US. We don't, but and patients don't know this. They don't understand this. Which is why I'm glad we're talking about this. About 2/3 of patients who are told that they need an amputation never even got a chance to see someone like us. Never even got a chance to see an interventional radiologist or vascular surgeon who can do these procedures under X-ray guidance. It's minimally invasive. We're not cutting you open. It's through a tiny little hole. We put a Band-Aid afterwards, we're done. And we're basically doing plumbing work through tiny needles, wires, and catheters that go down to the skinniest of blood vessels and open them up with balloons and little rotors. And we can save 80% of patients from getting amputation. And we've had patients coming from Pennsylvania all the way up to New Jersey who found us through a support group, and an elderly woman, her son brought her in. There's a testimonial that you can see on our website, and we saved her from getting her leg cut off.
Yeah. And so in this, what do you consider to be the difference maker? I mean, you shared a little bit about it, but when 80% is a huge number. So when you break that down, what do you find to be the greatest difference maker for you?
So the difference maker is we're able to go down to blood vessels that a lot of other doctors don't. So a lot of doctors like to stay in the thigh and treat those blood vessels because they're bigger, it's easier, you can get the patients in and out. It takes a lot of extra skills. And this hand, like my fingers know how to turn the wire and catheter. And it's the technique of knowing what to do and how to do it when you can't do it. So sometimes I'm even, and I don't want to like scare anyone, but I just want you to know that sometimes we even go put a skinny, tiny wire needle in the foot just so that we can go from below and above and connect from above. And sometimes you can't do everything from the arm or the groin. You have to go into the foot. And the patients really don't feel pain. We actually give them conscious sedation. And they are so, I mean, afterwards they can feel a difference right away. One thing I want to say is that once a patient gets an amputation, what people don't realize is, like you said, psychologically they're depressed, they're sad, they're now they're debilitated, they're on in a wheelchair, they need rehabilitation, they need someone to help them get onto a prosthesis so that they can walk again, and that wound has to heal first, and they start declining very fast. They're not able to exercise, they're not going to eat the way they used to. All of that compounded leads to early death. And I hate to say that, but 50% of patients are will pass away in the first year or two.
Ah, amazing. Well, thank you so much for sharing with us, Dr. Elsie Koh. I think it's some very valuable information. Hopefully, we get people in early to be able to see you. So thank you so much. We want our viewers to know if you want more information, what you can do is visit the website, Endovascular.com. Then also follow them on their social media platforms on Facebook at Endovascular. Don't go anywhere. We got more open coming up right after this.